50 to 60% of women experience a urinary infection at least once in their lifetime. I am Dr. Subramanyam, consultant urologist and transplant surgeon at Apollo Hospitals, Jubilee Hills, Hyderabad. Today I will be talking about UTI and particularly with an emphasis on recurrent urinary tract infections, more often in women. We all know that infections are more common in women compared to men because of a variety of reasons. One of the commonest reasons is that the urine pipe or the urethra is quite short in women, and this predisposes them to get infections more often than men. However, if the patient gets more than 3 infections over a short period of time, we probably start investigating them to find out if there is any particular reason for infections. Now, infections produce a lot of urinary symptoms, particularly with frequency, urgency, passing small amounts of urine, and occasionally a bit of blood in the urine. But infections are very well treated with an antibiotic. The important thing about an infection is to get a urine sample, and particularly a urine culture, before the patient is put on antibiotic. The problem with a urine culture is there is very little instructions given to the patient about how a proper urine culture sample is to be collected. Now, to collect a proper sample, which we call a clean catch midstream specimen, particularly a clean catch midstream specimen in women, is difficult unless the patient is given specific instructions about how the sample has to be collected. The important thing for the women to be told is that the genital area should be cleaned, dried with either a tissue or a towel, and then the labial folds or the skin folds should be opened, and the patient has to pass some urine initially and collect a sample from the middle of the flow. That is, the first part should be discarded and the flow in the middle should be collected, and this has to be given into the lab as soon as possible. Now, if you leave the sample outside at room temperature, a lot of bacteria grow in this urine sample and you would get a false report. So-called urinary infections with urine culture positive reports, which we see, are sometimes because of improper collection, and this is because the patients are not properly instructed how a sample has to be collected. Now, once we see infection in women, there are 2 age groups where infections are commonly seen. One is the sexually active women, where the intercourse itself triggers an infection because either dryness of the vaginal area or sometimes a vaginal infection itself, which allows the bacteria to migrate from the vagina into the bladder. The second age group where we see infections are postmenopausal women, where postmenopausal, when the hormone deficiency is there, the lining of the vagina as well as the urine pipe changes from the previous lining. Now they get what we call more keratinization, and this will make it prone for an infection. So if you understand these 2 things, that infections in women are more common in younger age group because of sexual intercourse, elderly women more common because of hormone deficiency, we would know how to tackle these and how to prevent these infections from coming back. So one of the commonest problems which you see in young women is recurrent infections, and these infections are usually triggered by intercourse. The bacteria are always there in the vagina, and these bacteria migrate from the vagina to the bladder and produce a urinary infection. Now, there are a few things that women can take care to prevent an infection from happening after an intercourse. We understand that the vaginal flora or bacteria in the vagina are the main cause for infection. So, a good vaginal hygiene, if the patient has got a wide discharge or a vaginal bacteria or vaginal flora which are infective, a gynecologist would probably be able to sort them out. So, once the vaginal problem is cleared, the chances of infection do come down. The second thing is sexual intercourse, which triggers the infection. It's usually because of dryness, and so we tell our patients to use a lubricant. There are a lot of inert lubricants which are available in the market, and at the time of intercourse, a lubricant would definitely go a long way to prevent infection following intercourse. The third thing we tell our patients, particularly those who get infections following sexual activity, is to go and empty the bladder within about 10-15 minutes after intercourse, so that whatever bacteria which migrate into the bladder get washed out, and the chances of infections coming down or having an infection is very little. So a few general principles would probably go a long way to prevent recurrent infections in women, particularly the sexually active women. Now we come to the second group, where elderly women, postmenopausal, getting recurrent infections. Now these infections are because of hormone deficiency. So the treatment in this case would be to replace the hormones. Now hormone replacement can be given in form of oral tablets, but if the problem is only a local problem, that is there is a vaginal change or lining of the vagina is changed because of hormones, what we call atrophic vaginitis, in those patients an estrogen vaginal cream, an ointment which can be put in the vagina at night, which will release the hormones, and these hormones work on the vaginal wall as well as the urine pipe and probably make them more immune to infections, so that the number of infections in women do come down. We also have some women who have recurrent infections, that is the moment they are off an antibiotic, they come back with another episode of infections. In these women, one good option which we do, one good way of treating these people is giving a small dose of antibiotic continuously for about 2 to 3 months, and this would probably build up their immunity so that they would get more resistant to catching another infection. And there are a lot of drugs which are available which are given in a very small dose, less toxicity, and on a long-term basis for about 2 to 3 months, so that you don't get infections. Now, some women do come back in spite of all this with recurrent infections. In these patients, a urethral dilatation, that is where the urine pipe is dilated, would also sometimes help. The theory behind is that around the urethra there are a lot of glands which harbor the bacteria, where the bacteria go and hide and they are not killed by the antibiotic. And if you stretch the urine pipe, these glands are squeezed and therefore the bacteria come out and prevent further infections. So there are multiple ways where we can treat patients with recurrent urinary tract infections. I also need to mention that sometimes if patients do get infections which don't appear to be only a bladder infections, that is only urinary symptoms, but they have loin pain or pain in the back, they have high grade fever, chills and rigors. In those patients we definitely need some more investigations to find out if there is any specific abnormality in the urinary tract. It could be a stone, it could be some obstruction to the urine flow from the kidney, it could be particularly in diabetic women, it could be what we call papillary necrosis, where small bits of the tissue block the urine flow from the kidney. So these are things which we need to investigate. So the straightforward urinary infections which we see is what we call lower tract infections, that is infections in the urine pipe and the bladder, and these infections don't go up into the kidney. But if you get an infection into the kidney, then definitely it is worth investigating to find out if there is any structural abnormality in the kidney by way of an obstruction, a stone, or any other abnormality which makes this kidney prone for infection.